medications should not be stopped by the patient by themselves. If they want to stop the medications, they should consult their doctor first. There should be shared concern. The patient should tell the doctor why they want to stop. If there's any doubts, there should be a good communication with the patient and the doctor, and also at the same time it should be a shared decision making. Many patients have chronic medical conditions like diabetes, hypertension, thyroid disorders, psychiatric conditions, chronic lung disease, or even depression, and also like inflammatory bowel disease. These patients are on medications for quite a long time. Stopping the medication can cause worsening of their clinical condition and also something called withdrawal reactions, or AD, adverse drug withdrawal events. Therefore, it's very dangerous if this occurs. Instead of stopping the medications, they should adopt this approach, which is talking to the doctor, and the doctor will then decide to taper down the medications gradually so that we get the optimum control of the condition, and at the same time we do not have the adverse drug withdrawal events. Secondly, if let's say the medication which the patient thinks has caused them to experience an unpleasant or unwanted side effect, then the patient should not stop by himself but come to see the doctor and come to seek his opinion. And if the doctor thinks that this side effect was attributed to the offending drug, then the medication will be stopped. At the same time, when the patient comes to seek the doctor's advice, there will be treatment given for the allergic reaction, and there would be proper documentation for future reference. No medication should be stopped suddenly. This is because of the withdrawal reactions that can occur, such as corticosteroids. If it stops suddenly, it can cause drop of blood pressure, and the patient will feel fatigue and they'll be vomiting, and it is very dangerous to stop this medication. And the other medication like anti-epileptics or anti-seizure drugs should not be stopped suddenly because it can increase seizures and also confusion in the patient.
Okay, if you take the medications, you play a very important role in your own healthcare management when it comes to the medication safety. Sometimes patients expect the healthcare providers to know what they are actually taking, but the problem is you may have seen more than one doctor, gone to more than one pharmacy to have a prescription filled, or maybe not taking the medication the way it should be prescribed. Your healthcare team also works to keep a correct and up-to-date list and tries to make sure other people's caring for you also know about it. But if you yourself don't know everything that you take, something could be missed, like a medication that is very important in your health or one medication interacting with another medication. Medication are more than just those that a doctor prescribes. That includes a long list of medications that you buy over the counter, such as painkillers, cold medicines, vitamins and minerals, herbal medications, patches, inhalers, eye, ear, nose drops, creams, lotions, ointments, and even some samples that the doctors may give it to you when you visit them. You may ask, how often can I keep the complete record of my medications? Some people keep an up-to-date list of all their medication with them and take them to the clinic or hospital each time they visit. If you don't have one, that now we have a booklet for you to record your own medications and your vaccination records. So every time there are changes to your medication, you just have to update accordingly in the booklet. One of the important questions to ask regarding your medication would be regards to meals. For example, some medications should be taken before food or for better absorption, while some need to be taken after food for better absorption and possibly to reduce the stomach upset or other side effects. That being said, not all medications are affected, but it is still an important question to ask anyway. Another important thing to ask would be drug interactions. For example, some medications interact with food such as dairy and grapefruit juice. There are also possible drug-to-drug interactions such as antacids, which are commonly used to reduce gastric upset. Supplements such as iron and calcium tablets can also interact with some medications, so be sure to let your healthcare providers know if you are take any of those. Storage conditions are also extremely important. For example, does the medication need to be refrigerated? Some common examples will be insulin pens and certain injections. Medication stability after opening is also very, very important. Some eye drops are only stable for 1 month after opening and should be discarded after that, even if there is still a balance. Sometimes people keep it for ages and reuse it after a long time when they encounter similar symptoms again. This can be very, very dangerous as the eye drops is no longer sterile and can potentially cause interaction if they are contaminated. So it is extremely important to know how to store your medications properly and their stability.
Actually, there's a few types of situation that we can describe for patient, because sometimes they are not experienced in identify the medication because they are not familiar with the medical terms. So this can contribute them to go to medication error. So they need to get some explanation and also understand what is the terms and the medications that they are using. Beside that, like sometimes some patients they are quite rushing to take medication. So this also can contribute medication error. So they can take, despite of one medication, perhaps they go and take two. So they should be identified what is the medication and go cool and calm on this.
To make medication use safe, it's good to know that a person need to know her own conditions and also the medications that the person is taking. So if to know your medications, it's good to know it from the doctors or the pharmacists who let you take the medications. So for example, if you know the medications, so you can avoid a lot of mistakes or medications that are harmful. So when using medications, so it's good to use a memory check where if let's say we have a memory card, we can actually write down the medications that we are taking so we can follow and check. Besides that, it's good to know about medications allergies. If let's say our own conditions, we have allergies and we are not supposed to take certain medications that can cause allergies and cause harm. And other than that, to take medication safely, it's good to check about the 5 areas that medications, how we take medications. Like for example, is the medications being taken at the right time, or is the patients taking medications on the right route? Means that whether it's supposed to be taken orally or apply locally on the skin, or just use externally instead of taking orally, right? So all these we need to be very sure. And another part is, if let's say we are not sure about the medications or the medications can cause what type of effect, it's good to always ask and make sure before we consume the medications. And never share medications. If the medication is already ordered or given by a doctor to another person, and we think that we are actually having the same type of problems, and we tend to assume that taking that medication is good, but then or can be helpful, but then that is not right. Okay, so taking medications of somebody else actually can be harmful when we are not very sure. And medications that are not labeled is also considered not safe. When we don't know what medication is that, it can be just a simple tablet, and we choose to take that tablet, we are not sure what type of medications and what it can cause to the body. So it's not safe to take that type of medication. So when we are not sure, it's good that we throw that medication away. And never take medication unless you are 100% sure of what you are taking. So for keeping medication consumption safe, we need to check a few things or make sure that we know our medications, know our condition before we taking that medications. And for conditions wise, it's good that we always follow up with the doctors checking and make sure that the conditions is still required medications. If the medications taken is no more required, and we don't continue to take medications unnecessarily.